Locker Talk webcast series brought to you by BreachLock, a global leader in offensive security solutions offering continuous attack surface discovery, penetration testing, and red teaming. Hi, I'm Ann Chesbro, and I will be your host and moderator today. Today's webcast is all about offensive security requirements in the healthcare industry, including HIPAA. Today, healthcare organizations are under more pressure than ever to protect sensitive patient data while meeting strict regulatory requirements like HIPAA. Offensive security has emerged as a proactive approach that helps healthcare providers not only defend against cyber threats, but also stay compliant with regulations by identifying and addressing vulnerabilities before they are exploited. This webcast will explore how offensive security strategies, such as penetration testing and red teaming, can strengthen the defenses of healthcare organizations, reduce risk, and ultimately safeguard patient information that is exchanged between multiple medical IoT devices and software. Join us as we delve into practical approaches and the critical role offensive security plays in a robust healthcare compliance strategy. Now I'm excited to introduce our guest speaker. Our guest speaker and technical expert today is Russ Gleber. Russ recently joined BreachLock as the Director of Pen Testing Solutions and brings a wealth of experience spanning over 13 years in the cybersecurity industry. Russ's experience includes serving as a consultant, where he worked closely with leading healthcare companies to ensure they attained high-trust certification to help demonstrate compliance with multiple regulations and standards. In addition, Russ served in the United States Marine Corps as a senior weapons of mass destruction threat analyst and has worked in partnership with the FBI and special agents investigating cybersecurity and human trafficking threats. Welcome, Russ, and we are pleased to have you as our guest speaker today.
Thanks, Ann.
Before we start the webcast, I'd like to go over just a few logistics. If you have any questions during the discussion, please feel free to put them in the chat and we will try to answer them. We will also take questions from our audience at the end of the presentation. Lastly, today's webcast is being recorded live and will be made available on demand at breachlock.com after this live airing. With that introduction, I'd like to turn it over to our guest speaker, Russ Gleber.
Thanks, Ann. So as you mentioned, my name is Russ Gleber. I'm the Director of Pen Testing Solutions here for BreachLock. So what that means is really just supposed to be a technical expert around all things offensive security and really be a voice for our pen testers within our organization. A lot of different organizations have requirements for offensive security, and today we'll cover the healthcare industry specifically. But it's really my job to be, that technical aspect and be able to figure out what you need from a technical standpoint and find a way for BreachLock to make it happen. But today we're going to talk about the healthcare industry specifically as it relates to HIPAA, the HIPAA security rule, and how offensive security can help guide you down those paths. So the agenda, we're going to cover offensive security measures in healthcare as well as the HIPAA security rule. We'll talk about cyber attack trends in healthcare. What are the new emerging threats? What are the things that we're seeing exploited in the wild? And how you can help your organization really cater to those sorts of events. Connected medical devices and IoT. As there's more connected medical devices and various things that are connected to networks, it comes with more responsibility to maintain that client and patient data. So we'll talk about those devices as well. We'll cover a case study and get into Q&A before I leave you with 5 key points at the end for you to bring back to your organization. So essentially, the HIPAA security rule, it was published by the Department of Health and Human Services, or the HHS. If you're in the healthcare realm, which is probably why you're watching this, I'm sure you're very familiar with the HIPAA security rule. So we'll be covering how offensive security relates to those different administrative, technical, and physical safeguards that they talk about. Offensive security really focuses on proactive methods to uncover vulnerabilities, weaknesses, and flaws before malicious actors can exploit them. So if you as an org, you're using, some sort of security incident event management tools like a Splunk, a Graylog, a Datadog, you're seeing threat actors trying to hit you all day long, whether it be, 100 times or 1,000 times a day. And eventually they're going to find a way to break through those defenses. Offensive security really aims at figuring out what those holes in the gate are before these threat actors do, and how you can help patch those holes to make sure that we can keep client and customer and patient data safe. So as far as the security rule goes, they have technical, administrative, and physical safeguards. If you've ever had to do an audit in the healthcare realm, you know that they're very stringent. There's a lot of controls in place, but they're there for a reason. So technical safeguards are talking about access control, user authentications, transmission security encryption, and system activity reviews. Those administrative safeguards are talking about regular risk analysis, which is called risk assessments, in other organizations and industries, implementing those risk management policies, and workforce training and security awareness, which is arguably one of the most important parts of this. And then the physical safeguards. How can you physically, secure your environments, your networks, whether they're on-prem or in the cloud, controlling physical access to ePHI and implementing workstation security. So as far as offensive security measures, here at BreachLock, we do pen testing, red teaming exercises, vulnerability assessments, but many other organizations are doing them as well. At the core of your security program involved with HIPAA in the healthcare industry, you should be doing some sort of penetration testing activity. You should be doing regular and periodic vulnerability assessments, and a red team is always nice to throw in the mix as well. While the HIPAA security rule doesn't explicitly say that you need to do pen testing, manual pen testing by a human-led hacker really helps fulfill a lot of those controls and the various safeguards. And it takes a look at what vulnerabilities you have and whether or not they're actually able to be exploited. So as far as the key requirements around risk assessments goes, HIPAA wants to see regular risk assessments that are identifying these potential vulnerabilities and handling ePHI. For instance, penetration test can simulate a rogue attacker hitting an organization's database. Can I access that database internally? Can I uncover any sensitive patient data? Can I throw a ransom on that? Can I exfiltrate it to an offshore server somewhere? These are the type of risk assessments that HIPAA wants to see, and also the type of risk assessments that we owe to our patients as well. When we talk about vulnerability management, that could mean a whole lot of things. That's kind of just a giant program, but it's a very critical component of HIPAA as a whole. And it's the continuous identification and remediation of vulnerabilities that could lead to unauthorized access or data breaches. So whether vulnerability management means running periodic vulnerability scans to you or doing biannual pen tests, there needs to be some sort of offensive security measure that you're taking as part of your IT and your security program that's trying to hack away at your defenses and seeing if we can uncover any of that patient data. What does it look like when we can? Where can we send it? And also how long it takes you to be able to remediate the things that you find. If you ever have to talk to auditors or compliance folk, they're going to want to see that you're doing some sort of vulnerability management program, but also they want to see how long it's taking you to fix these things. So there's SLAs for a reason. Critical should be fixed anywhere between 3 and 7 business days. Highs, mediums, and lows branch off from there. But this overall vulnerability management program is really just going to want to see how you identify gaps in the fence, how long it takes you to fix them, and whether or not you're able to fix them. So now how can healthcare organizations align offensive security practices with your HIPAA? Do pen testing. The industry standard is every year. I would argue to say that that's not as frequent as it probably should be. Of course, there comes a funding piece with that as well. But regular pen testing should be the staple of an offensive security program. It's one thing to do vulnerability scans every so often. They're very useful and they give you a lot of good information as it pertains to network level threats and application layer threats. But not all of those vulnerabilities that it finds are actually exploitable. There could be a lot of false positives with there. So what actual manual human-led penetration testing aims to do is take a look at all those vulnerabilities that a rogue attacker would be able to see regardless and see if they can be exploited. If I have some sort of VPN running, can I take advantage of IKE threats? Can I uncover some sort of user credentials and gain access into your VPN server, and now I have access inside your internal network? Those are the types of things that pen testing should be doing, not just uncovering the vulnerabilities, but really peeling back that layer and seeing if they can be exploited. Another one would be red team and threat simulations. These aim to take pen testing a couple steps further. So we're not looking at the network layer and the application layer. Red teaming is really looking at people, process and technology. As we move more into the cloud market, cloud service providers, and we move things up into AWS and Azure, and some others, it's very important that you're doing some sort of red teaming or adversarial engagements just to understand your total security footprint. A large threat attack path for a lot of these threat actors is doing phishing assessment or phishing attacks, harnessing some sort of user credentials, which then you can then take into your M365 tenants or your Google tenants, and just drill down and lateral move from there. So red teaming should be thrown in some way, shape, or form, just to understand how people, process, and technology all plays together. And then continuous monitoring and auditing. There should be continuous monitoring going on, whether that be logs that you're aggregating into a centralized log management solution, or you're running, weekly vulnerability scans to uncover vulnerabilities and then attempting exploits from there. But you should be doing some sort of continuous monitoring and then auditing of those services as well. So as far as cyber attack trends in healthcare goes, once COVID hit, of course, we went more into the remote worker realm, and we really wanted to start seeing, how we could work from home, how we can access our data from home environments, and we really got away from like the on-prem brick and mortar sort of solutions. So because of this, healthcare is really a top target for cyber attacks because threat actors and groups understand that sensitive patient data that's in there, and they understand what kind of damage that takes part in with national security and infrastructure from there. So we're relying on a lot of digital health systems like electronic health records and connected medical devices in the healthcare realms nowadays. And the rise of remote care and telemedicine through the pandemic really opened all these doors for attackers. Ransomware attacks are one of the most common attack vectors from here. Finding some way to gain those credentials that we were talking about, drill down into your systems, find patient data, and put a ransom on it. Threat actors and groups know that you're more than likely going to pay the money for that, and it's a quick win for them if they're able to just send out a phishing attack across your organization to get credentials there. In 2023 alone, nearly a third of all ransomware attacks were really aimed at the healthcare sector specifically because of the type of information that's held there. There's also the increasing adoption of the Internet of Things devices in healthcare, like remote patient monitoring devices, glucose meters, even smart hospital beds. And those are connecting to some sort of infrastructure within hospitals. And that's just another common attack vector that these threat actors can take and really uncover some of that data. Now, the impact of these cyber attacks is really just the patient care disruption. In 2020, there was a German hospital that had a ransomware attack, and they had to shut down a whole bunch of their systems, which means they had to push patients to a different facility. That led to a delay in emergency treatment for one of their patients. That patient later died, and that all became a threat just because of a ransomware attack that happened. So we always think about like the technology attacks that are happening. What is the risk to technology? But this is really a risk to our patients as a whole here. There's the financial loss as well. In 2023, the average cost of healthcare data breaches was somewhere around 10 to 11 million, according to IBM. And that's a huge market of money there that's just really being exploited in the wild. So for connected medical devices and IoT, I hit on a few of them already, but we're talking, continuous glucose monitors, smart pacemakers are a huge one, ventilators, remote patient monitoring devices. As we grow in the world and we become more technologically advanced, there's just more risks that are associated with these things. So for all those that I listed, the big risks associated with those, man-in-the-middle attacks. If your encryption's out of date, a rogue attacker can kind of intercept that information that's going between IoT device and some sort of server. They can intercept it, maybe potentially alter that communication between the device and uncover sensitive information from there. If they're able to gain access to some sort of device, they can also launch DDoS attacks or just regular old denial of service attacks. And like I mentioned, your organization is probably getting poked and prodded hundreds, if not thousands of times a day anyway. Once they find a way inside your network, they're going to launch these attacks just to really shut down operations so they have time to laterally move and figure out what it is that they can exploit from there. And then third-party data sharing. As we've become more of a remote, sort of world and working away from these facilities, there's more third parties that we're bringing inside of our organizations, and BreachLock even being one of those is, your offensive security provider. So in the rise of this remote computing age, we rely on a lot of these vendors to keep track of that sensitive information, the PHI, for our patients. So it's really important that you're doing your due diligence. You conduct vendor assessments prior to onboarding these vendors. Ask for their different certifications, whether they're doing high trust or SOC 2 or ISO 27001 or any of those sort of heavy hitters. Ask for those things up front. If you don't have some sort of vendor management, department or organization from within your company, you should spin those up. And those are questions that you should be asking before onboarding these third parties. Now we'll get into a case study here with Change Healthcare. I'm aware that most of you watching this are probably in the healthcare realm, and I'm sure that you're intimately familiar with what this attack happened. I was in the consulting space, working for a small consulting company in New York when this happened, but a lot of our clientele was, in healthcare, hospitals, health insurance, or HIEs. And it seemed like the world just really slowed down and stopped that day. Everything was put on hold, and we just needed to figure out what the extent of this was. So in 2024, Change Healthcare, they were hit by a ransomware attack. It disrupted a whole bunch of systems, and it led to significant operational downtime. The ransom was somewhere around $22 million, and I believe that they're saying the total loss with vendors, the ransom, and all sorts of activities there is somewhere around 10 to 12 billion dollars. So huge chunk of money lost for them. However, what's more important here was the sensitive patient information that was breached. So that attack really affected a range of services. It was the revenue cycle management, payment processing, data exchange systems, and it served a ton of hospitals and healthcare providers around the world. And it was believed that the attack method came through a Citrix portal. So some sort of phishing activity happened. Credentials were harvested. They were then used to be able to access that RDP system or Citrix. Then this attacker was then able to laterally move from within inside that network and gain access to patient data through there, set up ransoms, and really do a lot of damage. The reason this was able to be exploited, there was no MFA in place on the Citrix portal. So classic case of bad actor getting access to credentials and actually being able to use the credentials because MFA wasn't there. The consequences of this one, obviously operational disruption. This was across the entire world. We all felt it in this one. The regulatory impacts, the investigations are still ongoing to this day, and the financial losses. So obviously this was on a huge, giant scale here, but these are happening each and every day. Regardless of what kind of healthcare company you are, if you're working in insurance or you're a hospital, you're a small patient practice, things like this are happening. When I was doing a pen test in a previous life, I remember I was working for a eye care company, and I was doing a pen test for them, and they had a guest network. The password, it was just typed out on a piece of paper and plastered all around inside their facility, right, for the guests to be able to use and log into the guest network. I was able to see that from the parking lot. So from my car, I logged into the guest network and found out that they had no segmentation on their network. So the guest network led directly to the corporate network as well. And I was able to run port scans, vulnerability scans, and just see all sorts of holes that I could exploit from there. And it was just something as silly as not having network segmentation on their devices. So something like that could have led to, a Change Healthcare sort of attack, but it wasn't from phishing. It was just from having guest passwords. Now, the top 5 things for you to do now, I wanted to be able to leave you with something here for you to take back to your organizations. Number one, conduct regular vulnerability scans and pen tests. This is the number one way to be able to figure out if I am an external rogue attacker, what can I see about your organization? If you have 50 public IPs with a few ports open on each of them, let me see how many of them are out of date. Let me take a look at CVEs that are published for those and figure out what exploits work for them. Conduct regular vulnerability scans, either quarterly, monthly if you're able to do it, or with any significant change to your security program or your IT department, just to understand what these new changes have brought about as far as vulnerabilities go, and your total external footprint there. And then do penetration testing. Again, I mentioned earlier, industry standard once a year. I would say do that more often. If you can only do once a year, just make sure that you're getting an in-depth pen test done. Number two, implement network segmentation for IoT and connected medical devices. As we, progress and have more technology throughout the world, we're just going to rely on more remote connections and more of these devices. So if you're an organization that has these sorts of like lab equipment or IoT devices connected to your network, make sure they're segmented from the rest of the network. There should never be a time where I can go in and try and mess with the hardware of this thing, gain access to it, and then be able to traverse across into your corporate network. That's just a bad setup of your IT environment there. So make sure there's a network segmentation. Any of these devices that are carrying these sensitive, patient data, or maybe they're out of date, and you just can't do much about them because they're from a third party, and they have to update them, but you can't get the funding to buy new equipment yet. Segment them on a different portion of the network. So if something is accessed, it's just contained from within that one segment. Three, strengthen your access controls and privilege management. This one, again, as we become more and more remote, this is very important. Another good way that remote attackers are gaining access into things is through, mobile devices, the M365s, the Google Cloud platforms, and things of those sorts. So as IT folk, we're very focused on making sure that our endpoints and our workstations are secure. We're pushing GPOs to those. We probably have some sort of endpoint detection and response toolings on those. But as we become more remote, our employees are relying more and more on their personal devices. So I know you can say, we have an MDM policy, or we have a personal device policy or BYOD policy. That doesn't mean that your employees aren't using these systems. So, if I'm in your network and I'm on a workstation that's owned by your environment, say it's domain joint, I have to log in with my AD credentials in order to access this. I'm probably not able to do anything too risky there because an endpoint detection response tool is going to block me. So if I'm trying to run some sort of Python script or bash scripts from command line, I'm probably going to get blocked on a company-owned workstation. Ways that we've done it in the past is, well, if I can log into, OneDrive from a mobile device that's not managed by the organization, I'm just going to upload those files there and then download them on the device themselves. So having an MDM or, some sort of mobile application management tool like an Intune on like BYOD devices or employee-owned devices that's going to be able to access any of the sensitive information is going to be very, very powerful and important there. And it's really just going to help strengthen those access controls and privilege management from there. Four, conduct a walkthrough of a HIPAA checklist. They're everywhere. Most auditing and consulting companies have a HIPAA checklist that they publish. I don't know if HHS really has a formalized HIPAA checklist that they push out. But do one of those checklists and walk down through all of those controls. It'll walk you down through the administrative, the technical, and the physical controls that the HIPAA security rule wants. Walk down that checklist, make sure that you have all those controls in place. If you don't, well, now you have a worthwhile exercise to understand where you may have some gaps, either in your systems, your technology, or your processes as a whole, and you can fix those from there. And then number 5 would be adopting some sort of continuous threat exposure management solution. CTEM is one of those new buzzwords that's being thrown around, but it's a very powerful, acronym there. What continuous threat exposure management aims to do is still take account of those, manual human-led pen tests every so often, whether that's once a year or it's on a periodic basis, but also fill in the gaps of when those pen tests aren't happening. So if I'm running pen tests once a year, I need to be able to do some sort of automated scanning or source code reviews or something that's really filling in the gaps between the times that I'm not doing manual exploitations, just to understand what my continuous threat exposure is from the outside and from the inside. So if you get nothing else out of this presentation, just at least take those 5 things, think about them, bring them back to your organization, and really just, help our patients and help secure our data from there.
Great, Russ. Thank you so much. Some excellent points there, some really good stuff. So thank you. So we have a question coming in from one of our audience members. It's actually a customer, and the question is a good one. In what ways does offensive security help us assess the security of third-party applications and APIs that interact with our patient health information, as HIPAA requires for business associate agreements?
Yeah, that's a great question. So as we onboard more of these third parties, there's a lot of APIs that we start embedding within our own applications and our developed software from there. And there's a lot of vendors that we're really bringing into our organizations that we're trusting to be able to secure that patient data. So I would say if you include APIs that are embedded within those web applications in the way that you're doing your web application pen tests, as well as making sure you're being diligent with your vendor onboarding. If I'm going to let a third party inside my organization that has, some way to access that patient data, I need to make sure that I'm assessing that vendor that's coming in to make sure that they're doing their due diligence and getting some sort of, security certification, whether it be a SOC 2, preferably a high trust in this case, or an ISO 27001, just to understand that they have controls in place that isn't going to leak out patient data on their side when it connects on our side.
Yeah, and I think with regard to the BAAs, the business associate agreements, I think for those who may not be familiar, they can go onto the HIPAA website and learn more about that. Russ?
Yeah, so BAAs, they're specific to the healthcare field, as we all know, but it's important to take a look at your BAAs as well when you're doing things like tabletop exercises for your incident response plans or business continuity events. BAAs play a role inside that security program because you need to understand what that reporting needs to look like to your vendors, to your clients, to media, and things like that. So as you're going through and you're doing TTXs or you're taking a look at how you would handle incidents where a breach has occurred, think about what those timeframes look like. Think about the mandatory disclosures, what information and what sorts of evidence you need to bring to the table as well.
Yeah, terrific. Thanks for that. The next question you've touched upon, but it's really more specific to incident response. So the question is, how does red teaming differ from traditional penetration testing or penetration testing in helping healthcare organizations evaluate HIPAA required incident response plans and their effectiveness?
Yeah, that's a great question. And that's a question we're being asked every day, as we're giving presentations to our clientele and doing pen tests for them. I think there's a big misconception when it comes to what pen testing is and what red teaming is. I guess a little bit convoluted there. A manual penetration test should just be taking a look at either network layer or application layer, uncovering what the vulnerabilities are and attempting to do some sort of manual exploitation there. So there's really like a left and right lateral limit there of understanding at the application layer, what are the vulnerabilities? What are the holes? Are they able to be exploited? Can I pull evidence of that from there? Whereas a red team is really taking into account people, process, and technology. It's being able to exploit across your entire landscape and your attack surface. So typical red team engagement will start with doing some sort of OSINT activity, open source intelligence, understanding what your attack footprint looks like from a rogue attacker point of view, trying to harvest some sort of credentials, whether that be a phishing attack or data breach, dark web exposure from there, and then attempting to actually gain access inside networks and conduct lateral movements, exfiltration of data. And it's just a more in-depth and custom solution for your organization as opposed to penetration testing of a network or application layer.
Terrific, terrific. And I know we're nearing time here, so we have one more question that we'd like to pose. And I know you've touched a little bit upon this, but maybe you can go into a little bit more detail. It says, what specific types of exploits or misconfigurations do offensive security tests typically uncover in a healthcare network infrastructure, and how do these relate to HIPAA's physical and technical safeguards?
Yeah, that's another good question. A lot of it lies from within network segmentation. I know as healthcare providers, you probably have a lot of IoT or OT devices that are inside your network that may be out of date. When it comes to updating a lot of those devices, there's the FDA that's in play there, and I know that change management really takes a while to be able to implement change on those sort of devices. So a lot of times their encryption methods are out of date. They're transmitting user credentials in plain text, and you can really do a lot of manipulation with the data that's coming in and out of those devices. So really here, network segmentation blocks a vast majority of the types of attacks that we would be aiming to, exploit against those devices. And then just your typical attacks that happen against the application layer. So your injections, your CSRFs, and things on the OWASP top 10 from there.
Terrific, terrific. Well, this concludes our webcast for today on offensive security requirements in the healthcare industry. I would like to thank all of you who attended, and a big thank you to our guest speaker, Russ Gleaver. Please note that this webcast will be made available on demand at breachlock.com after the airing. If you would like more information about BreachLock, about offensive security in healthcare, please wait for the closing and we'll provide more information on how to contact us. So thank you to everybody today, and thanks to Russ.